Hello, my name is Jesse, and I'm here today to talk to you about my experiences. Um, I'm from Cape Breton Island, Nova Scotia, and I recently moved here to Ontario. But back home, I grew up in a pretty broken home, an alcoholic home, and a pretty dependent, drug-dependent home. My experiences growing up were that of drugs and alcohol. That was how I learned how to deal with my emotions and how to share my feelings. But other than that, that was what I learned. That was what I seen. So I very quickly learned that self-medicating was a way to deal with things. That was how I dealt with my alienation, my depression, and some mental health concerns. It made me feel like I could handle things on my own. But that quickly spun out of control. Very quick. Throughout my teens, I was very disconnected and, like I said, depressed. Didn't know how to deal with things. That carried on throughout my 20s. I was actually a father very young at 19, and my children were born, but the cycle just repeated from the time I was a boy, and I carried them things that I learned growing up into my home, and my children started to kind of suffer the same circumstances that I did, wondering if Dad was okay and if he was going to come home at night, and that just broke my heart. But quickly it led to me actually having a pretty massive attempt on my life. I actually tried to end my life in Cape Breton, and I took an overdose, and I quite literally threw myself over a cliff. And I'm very lucky to be here. By the grace of God, I am here. But when I came to, my family was all around me. Seeing me, I wasn't able to speak. My body was broken. Seeing the looks on their faces and just how afraid and the trauma that they were experiencing right then and there, I was just carrying all of that forward, and I knew it. I was finally able to get honest with myself and realize that I needed to get help, because either I was going to die, and that's what they were going to have to live with, like I had lived with. I lost my father to suicide because of drugs and alcohol. He didn't know how to deal with things, and that's what led to the cycle just kept repeating. So I realized then I needed to reach out and get help. I came here to Ontario. I got involved with AMHS, and things have just been going absolutely incredible. Like, I actually have a very good quality of life now because of the methadone program. I got involved with my counselors. I got involved with my peers and with the doctors. I'm working on my mental health, working on my physical health. Now that I'm not dependent on actual drugs and alcohol, I can actually start to live again. And that's the truth. I know it sounds hokey, but it's true. The program has quite literally contributed to saving my life.
The power of the human spirit to endure sometimes absolute horrific challenges, to rise from a dark place that appeared as though no hope was left, to be brave and go far beyond one's comfort zone, to reach amazing heights that one may not have thought was possible, never ceases to amaze me. I believe this is one of the most beautiful and rewarding moments of being an addiction counselor, to see someone succeed and reach their goals, especially when one didn't think it was possible. Good day, everyone. My name is Brian Carnevale, and I'm an addictions counselor in the opioid management program at Addictions and Mental Health Services of Hastings Prince Edward. At Addictions and Mental Health Services of Hastings Prince Edward, together with our community partners in policing, emergency services, public health, and medicine, we are very grateful that you've decided to listen to our virtual symposium to commemorate International Overdose Awareness Day, today, August 31st. Before we begin, I'd like to acknowledge and honor the land on which we reside and occupy, as part of the traditional territories of the Haudenosaunee and Anishinaabe people. International Overdose Awareness Day is a movement that was started by Sally J. Finn at the Salvation Army in St. Kilda, Melbourne, Australia in 2001. The primary goal of the movement aims to bring awareness of the fast-growing situation of overdose across the world, and to provide a way for us to remember those we have lost and those who have suffered permanent injury in a stigma-free environment. It also serves as an opportunity to educate our communities how to prevent overdose. It also serves, also very importantly, the movement provides an opportunity to continue to boost those people who are on their recovery journeys and to inspire hope to help those who have yet to begin. To give you an interesting statistic, on how fast this movement is growing. In 2013, there were 6 countries that were involved in International Overdose Awareness Day, and 75 events were held that year. In 2018, there were 39 countries involved, and 874 events were held. COVID did slow things down in 2020. However, I believe in 2021, the movement is growing as fast as ever. Addictions and Mental Health Services of Hastings Prince Edward believes that the time to bring awareness to overdose is now more important than ever. We are all very tired of hearing about the torment that COVID-19 has had on us for the last year and a half. But it's really important to know that COVID has had a huge devastating impact for a lot of people who use substances. We can all remember just how hard it was to deal with the worry of fear that COVID brought. A lot of people lost their jobs. A lot of people lost a loved one during the lockdowns. Probably all of us had a hard time dealing with isolation. Many people were without resources such as an iPad to FaceTime. Important to mention, almost all of us didn't cope that well without our normal supports. Now, on top of all that stress that COVID brought, what if you had a mental health problem or an addiction? We believe that the statistics of Hastings Prince Edward clearly tell us that COVID-19 has greatly affected those people who live with substance abuse issues. In Hastings and Prince Edward counties in 2019, there were 3,071 naloxone or Narcan kits handed out. And in 2020, that number jumped to 5,530 kits. The number of emergency room visits related to opioid overdoses jumped from 133 visits to 205 visits in 2020. Another really grim fact to think of is that these statistics do not capture everyone. I know this because my colleagues and I talk to far too many people who do not call for an ambulance when an overdose happens. I hear stories that people are afraid to call because they're afraid to get into trouble with the police. They sometimes think it's a waste of time to go to the hospital. Between 2019 and 2020, the number of deaths in Hastings, Prince Edward counties rose by 75%. This is a terrifying number. If the overdose statistics remain the same for the first quarter or first 4 months of 2021, we are going to lose a frightening amount of people. International Overdose Awareness Day also reminds us that these are not just statistics. These are not just numbers. These are people in our communities, people in our neighborhoods. As the posters behind me show, it's someone's mother, someone's sister or brother, someone's buddy or best friend, someone who needs our help. Please believe me when I say there is no one person, no one group of people, no age group, no race, no socioeconomic class that addiction does not reach across. I would like us to remember those friends and loved ones that we have lost to overdose and those who have suffered permanent injury as a result of overdose. Please join me in a moment of silence. On a positive note, in this fight against addiction, there is help. And there is always some way that we can help someone who is in need. Even the smallest bits of help can have life-altering impacts. In just a bit, we will learn more about how we can help someone who is in need. I feel that we are very fortunate to have with us today an expert lineup of guests. Constable Maggie Pickett of the Quinte West OPP is a community mental health officer and has been serving in our community for 14 years, as well as her colleague, Constable Devin Leeworthy, who is a community safety officer. They're going to explain to us exactly how the Good Samaritan Drug Act works, so people in certain criminal situations who use drugs can call the police and not fear getting into trouble. And joining Constable Pickett and Constable Leeworthy today is Haley Leach, who is a crisis intervention specialist with Hastings, Prince Edward, Lennox, and Addington Victim Services. Haley is going to explain to us what victim services can offer during an overdose incident. We're also going to hear from Dominic Raham, who is an advanced paramedic with Hastings Quinte Paramedics Services. He's been serving in our community for the last 15 years. Dominic is going to tell us about why it is so important that people who experience an overdose really need to go to the hospital. He will also share what receiving help looks like from paramedics. Christy Reeve has been a public health nurse with Hastings Prince Edward Public Health for the last 16 years. She has been working in harm reduction and outreach for several years. Christy is going to share with us a very important message about stigma and also show us how you can save a person's life in a matter of moments. Last but not least, we are very fortunate to have with us Dr. Melissa Holowaty, who is the current chair of the member interest group in addiction medicine at the College of Family Physicians of Canada. Least to say, she knows an incredible amount about addiction medicine. You'll hear later in the video how she helped turn two people's lives around. Dr. Holowaty is going to show us how someone in need can use medicaid-assisted treatment, such as Suboxone or methadone. She will also tell us about some of the medications that are available to people who use alcohol. A real highlight of the symposium today is that after each one of our speakers, a person with lived experience is going to share their recovery story. We believe that their stories will show you that change is possible, just as Jesse did with his story. I also hope for those in need, their stories will inspire you and offer you hope. Addiction and Mental Health Services of Hastings Prince Edward is not going to let this day go by without doing something to end overdose.
The problems all started when I was about 30. I was working in a factory, working shift work, and it was 12-hour shifts, mostly midnight shifts, and we switched back and forth every week. And I got working in there, and I mean, the shifts are long, and it got so that there was some young kids in there, and they were doing a little bit of cocaine, some pills and stuff like that. I got hooked up with them, and I started using them to get through the shift. And I mean, it just got worse and worse and worse. I kept doing more and more and more. Then I was working overtime. That was what I called my mad money, I guess it would be. So I could buy more substance. So I could work more, and it just got so it was piling up, and I was doing more and more and more. And finally one day, me and my friends were driving around, we were doing quite a bit of substance. I mean, we got into it pretty deep. I wasn't feeling very well, and I wasn't far from my mom's, so I drove over to my mom's, and by the time I got there, I wasn't feeling good at all, and she ended up phoning an ambulance. By the time the ambulance got there, I was out. I had passed out. I was turning blue, and I wasn't breathing. They had a hard time to find a pulse, and they took me to the hospital. I woke up in the hospital about it was 11 days. 11 days I slept. I was in a coma for 11 days after I got to the hospital, and I woke up in there one night, and I mean, I didn't know what I was doing. I didn't know how I got there, and the nurse explained it to me. So I was in there for about 2 weeks, I guess, and I got strong enough, and they just released me. And when they released me, I didn't ask for any help. They didn't offer any help, and I just got back. So I was off work for a little while, and then I got strong enough. I went back to work, and I just fell back into the same routine all over again. And I mean, one day I was behind on my bills. I was having a hard time keeping the chores done around home. It was a mess. It was a real mess. So I got talking to my sister. She's a nurse in town here, and she's a really caring person. And she did the research, hooked me up with AMHS, and I went and see my counselor, Brian, and he hooked me up with Dr. Holowaty, which is in Trenton. And the whole system between that, rehab, I went to rehab a couple times, and it turned my life right around. I'm doing fine now, and things are going really well, and it's great.
Good morning, everyone. It's Constable Maggie Pickett here, and I'm along with Haley Beach from Victim Services. We just wanted to talk to you guys a little bit about the Quinte West Good Samaritan Drug Overdose Act campaign, which is actually launching today, and it's going to run until November. So thank you for allowing us to use this platform to share our information about that. A little bit about the Good Samaritan Drug Overdose Act. It actually became a law in May of 2017. And the purpose behind the law was to reduce fear among people for calling emergency services when they are witnessing an overdose act. So what the law does is it actually provides legal immunity, we'll say, for charges of possession of drugs, as well as any bail conditions, probation, parole, or conditional sentences that pertain to drug possession. So we really want to encourage people, don't be fearful of contacting 911 if they are witnessing a drug overdose. Our primary focus when we do get those calls for service are to attend and to administer life-saving care. Every officer at our detachment has naloxone that we carry on us when we're on duty, and that will be our primary focus. So we just want to encourage and make sure that you call 911.
So my name is Haley, and I am a crisis intervention specialist with Victim Services of Hastings, Prince Edward, Lennox, and Addington counties. And for those of you who maybe aren't familiar with Victim Services, what we do is we offer crisis intervention and follow-up support to any victims of crime or tragic circumstance. So the overdose category would fall under more of the tragic circumstance piece. And what we do, so everything is a bit of a case-by-case basis, but mainly what we do is help the families or anyone not directly affected by the overdose, but indirectly affected. So whether that's on scene, helping the family members deal with kind of the trauma that comes with, whether that be a fatal overdose or even an overdose where a family member or friend has just been taken to hospital. But that also kind of long-term may look a little bit differently. So whether that's getting families set up with counseling support to help them through that in the long run, or providing some supports for fatal overdoses, which may look like crime scene cleanup, or even helping getting some families accommodations for some overdoses that I've worked on. Sometimes the police have to hold the scene overnight. And if that overdose or a fatal overdose took place in a spot where multiple people are living in that residence, it puts them out of their home for whether that's 1 or 2 days. And that's hard in kind of this climate to be able to just afford to go and find a hotel for yourself off the cuff. So depending on the circumstances, Victim Services is able to help get different accommodations set up for individuals. But I would say for the most part, which I think everybody here is familiar with, that dealing with an overdose, whether fatal or not, is pretty traumatic for everybody involved, and there's just no kind of guidebook on how to walk you through it. So a lot of our role is just to be the support that you might not know you needed, and to answer the questions that maybe officers are too busy during an investigation. Or I always say to my clients that if you have a question and you're not sure who to ask, there's never a silly question or a stupid question. I'm here to help and point you in the right direction. So we kind of step in as that in-between support.
Standardized approach.
My struggles with addiction started in my mid-teens when I was in high school, progressed throughout my 20s, and it was after a surgery that I had in 2010 that I was prescribed opioid painkillers for the pain that I was in. And as much as I was taking them for a legitimate reason of being in pain, I did enjoy the way that they felt. It wasn't until quite a few years later when I went back to work. I was working at a pharmacy when my youngest started kindergarten, and when I started taking opioids again on a regular basis. I was taking them from work. I was sometimes getting them from friends, and I was terrified to get caught. Of what would happen. I was terrified of stopping because I didn't want to have to deal with the withdrawal and being sick, because opioid withdrawal and sickness is one of the scariest, most painful things I've ever been through. It did happen that eventually I did get caught, and as much as that was terrifying, it was probably the best thing that ever happened to me and likely saved my life. I got in touch with my doctor after this, who prescribed me with Suboxone to help with opioid withdrawal and maintenance of staying sober, which was probably the best decision I ever made. The doctors aren't there to judge, for if you're getting clean, they're the best people to reach out for. Along with my doctor's help, I got in touch with a counselor who specializes in addictions, and that was another one of the best things I've ever done, who I still talk to this day. I'm just over 6 months clean, and it's something that really helps me stay sober, just to have somebody in my life that I can kind of talk to, reach out to, and give me advice on how to keep staying sober. And not even just that, just on everyday things they can help you with. Meetings as well, Alcoholics Anonymous or Narcotics Anonymous. I don't know if that's everybody's thing, but for me, I found that really helps. Any sort of resource I can have helps. And so that's my story. I also want to touch on, in 2014, we lost my brother-in-law to a fentanyl overdose. So Jessie was living with my mother-in-law at the time, and she had gone away on a vacation. And she was quite worried to go away because at that time Jessie had been 3 months sober. My mother-in-law had tried to reach him overnight, but he wasn't answering the phone. So she asked me to go and check on him. And when I went across the street to check on him, I knocked on the door. He didn't answer. And when I opened the door, it was quite clear that he had an overdose. Now, because he was 3 months clean, it's likely because his tolerance had gone down and he had tried to use as much as he used to. And of course, his heart couldn't handle it and he passed away. That had quite an impact on our entire family. My mother-in-law, my husband, who is his brother, my daughters, his nieces. I mean, it's 7 years later and there's people still in therapy trying to deal with the trauma of losing him because it all happened so fast.
Good morning, everybody, and thank you, Brian, for inviting me to participate in this event. So as Brian said, my name is Dominic. I'm an advanced care paramedic and have been a paramedic serving in this community, or rather our communities, for the past 15 years. If you're watching this, if you're participating in this event, you don't need me to tell you that substance abuse is a very complex topic. There's many different facets to it. So I'm proud to participate in this event surrounded by individuals, each specializing in a certain aspect of this very complex issue. That being said, I'm going to restrict myself to the strictly medical aspects of what we do. So as Brian mentioned earlier, COVID had a significant impact on everyone. Every different aspect of life, people from all walks of life were impacted by COVID. It was a worldwide phenomenon. It still is. What that means for substance users in the context of EMS, it means that our calls for opioid overdoses, or sometimes the call comes in as a more generic drug overdose, the statistics jumped quite significantly. So if I look at 1 year prior to COVID, you could measure that number of calls in the double digits. And I will say this as a little bit of a sort of a disclaimer, the way our system is set up is sometimes a little bit tricky to pull statistics from, but I'm sort of being generous with that, and I'm being a little bit deliberately, not generic, but anyway, double digits, shot up to triple digits during COVID, when COVID hit. And like Brian said, very aptly, it's because of the impact of things like isolation, things like stress and anxiety on human beings and how we cope with those things. So the number of calls jumped quite a bit for us. Why would you call 911, or why would you want paramedics involved in a case of drug overdose? The answer might seem a little bit self-evident, but I'm going to tell you a little bit about who we are and what we do. So we do have different levels of paramedicine in the communities, both of which are incredibly well prepared and incredibly well trained to handle drug overdose emergencies. I'm deliberately using the term drug overdose apart from opioid overdose because an overdose can take a bunch of different forms for us. So some overdoses may be unintentional, a lot of them are. Unfortunately, some overdoses are intentional, being suicide attempts or something like that. And the number of substances you can overdose on is almost limitless. So the stuff that we tend to see are what we would call street drugs, although not all of them are street drugs. Some of them are prescribed drugs that individuals have obtained for themselves or from other people. And the effect on our patients can be just as complex and just as diverse. So during my time on the road, responding to calls like this. I've seen my share of overdoses on heroin. There's fentanyl, there's all of the opiates and opioids that you can get as prescriptions as well. I remember one particular case where a poor guy had a pain condition and was regularly prescribed painkillers, and someone else had found out about this and knew when he would get his prescription, and they would sort of pay him a visit to take his medications from him, sometimes by force. So these are very unfortunate circumstances that occur as a result of this issue. But in addition to the opioids, there's other stuff out there as well. So what we call sympathomimetic drugs, the ones that get your heart rate racing, so almost the exact opposite of what an opioid could do, can be just as dangerous for the human organism as well. The problem is sometimes people use these drugs in conjunction with each other, which sort of leads me to my next point. A mixed overdose is one of the more complex issues that we face in the field, and that is precisely why you should call paramedics to attend to whoever you happen to be with that's experiencing an overdose like that. We know how to manage these things. We know how to obtain the information that will guide our treatment plan in the field so that we can provide the best possible care for your friend, for your loved one, your significant other, whoever you happen to be with. That being said, I still very much want to impress on everybody that if you have an naloxone kit and you know that opioids are involved in the current situation that you're faced with, then use the naloxone kit because that has a very real impact on our patients. So how we handle these things, I'm going to be very blunt and very clear with everybody. When paramedics show up, we are very concerned about our own safety. So we go into a variety of calls in the community, and we need to be concerned about our safety, because if we get injured, we can't help you, we become a casualty of the situation, and it draws in kind of more resources. I want everybody to understand that, because we love working with our colleagues in the emergency services. So whether it's fire or police, I need everybody to understand that's watching this, that if we show up and we have police officers with us, it doesn't mean that you're getting in trouble or that we're getting you in trouble. A lot of the times we call upon their assistance to keep us safe, because our focus being patient care, we are 100% in the zone. We're looking at our patient, we're assessing, and we're doing stuff. We appreciate having somebody to watch our backs, okay? So I want to make that very clear to everybody. Aside from that, the medical care that we provide, we help people breathe. We can use fairly aggressive techniques to help people breathe with the goal of making sure that you can breathe adequately. The major danger, as you probably know, from opioid or opiate overdose is the decreased respiratory effort. So the brain just sort of starts the body breathing slower and more shallow until eventually you might not breathe at all. And that will be our primary focus when we show up, is to restore that breathing for you. In addition to this, based on our assessments, we can tell if there's a mixed overdose at play here, and we can sort of manage those other issues. The end goal is to take the patient to the hospital. The hospital is where that patient needs to be, because as good as we are in the field, there's doctors and nurses at the hospital that have a ton of experience with this and can help manage you from that point forward and help keep you alive. One of the things that we may have a conversation about, if the patient is awake and able to talk to us, is whether they'd like to get help for this substance use issue. And we will suggest various resources in the community or at the hospital as well. I want to take some time as well, just a minute or two, to mention the possible complications, because a lot of people think that when you've overdosed on an opioid, once you take the Narcan, you're good to go. You know, you'll wake up and you'll start breathing again. Really important for people to understand, but a lot of the times those drugs stay in your system far longer than the Narcan will. So once the Narcan wears off, you might find yourself back at square one. When you factor in other stuff, like I said, if you've taken some cocaine and you're trying to sort of mitigate that with some heroin, once the heroin is out of the equation, cocaine comes back with a vengeance. Now you're potentially at risk for things like heart attacks and things like that. If you're using unclean equipment or needles to inject, you're at risk for some really nasty infections. One of them is called cellulitis. It'll infect sort of the inside of your blood vessels. It can travel to your heart, to your brain. It can have some serious consequences for you. All of which to say, please don't be afraid to call 911. Please don't be afraid to call for an ambulance. We are there for you. We're there to provide the best possible care. We're not there to get you in trouble, okay? But there are some definite advantages to calling us. We want to respond to these calls and we want to help you. We suggest resources as well, like I mentioned. And I don't want anybody to sort of come away from this presentation with the idea that we're entirely focused on the clinical aspects of this. That is our main focus. But the paramedics who respond to these calls are human beings just like you are. So we have a vested interest in helping people survive this overdose and get better. Some of these stories are really heartbreaking, and I'm glad that we've seen some lived experience videos, because seeing those things reminds me that, like Brian said, there's always somebody at the core of what this issue is. And I think one of the most heartbreaking things for me is if I care for a patient and we sort of help them wake up and we help manage their medical situation, and the patient says something like, "You should have just let me die," or something like that. Nobody wants that. We don't want that. And that's why we're happy to show up, and we want to show up to help you. So please call 911 if you're faced with a situation like this, but use your naloxone kits as well, and be ready to help us out when we arrive. We always need a little bit of info to sort of get going to provide care. Okay, thank you for your time.
Timmy Jason Nordine, my husband, the man I was supposed to grow old with, the man I loved to the depths of my soul, and the man that irrevocably changed my life, me, and my children forever. He was. Talking about him in the past tense still seems odd, but he no longer is, so he was. He was the kindest, most generous, caring man I'd ever met. He was also the most frustrating, selfish, messed up individual I'd ever encountered. My Tim suffered from mental illness. He had clinical depression and anxiety issues. He self-medicated regularly. His story is much like many others. I would hazard a guess that many, if not most, who become addicted to drugs suffer from mental illness. They suffer because the system is broken. I make no excuses for him. He chose the path he walked, and he chose that path for me and my children. I often wonder, however, had there been another choice, would he have taken it? I'll never know. Tim's addiction had many faces. The manic, desperate fiend, the sad, lonely, desperate beggar, the triumphant comeback kid, ready to face the demons and right all the wrongs. The point is, he fought as hard as he could against a monster within himself that he could never beat. He knew it, we all did, and in the end it won, and it took my whole life with him. Tim was a gentle giant, tough and strong, but afraid of spiders, and his mom, of course. He came to me when I was alone with 2 babies under a year old and a teenage daughter. He fit in and took on the father role like it was second nature. I will forever love him for being that brave or crazy, I'm not sure which. Sometimes I blame myself for adding the stress of an instant family, that maybe that was a factor. Again, no one can know what made him choose what he did that day. If he's here today, I would tell him that we miss him and we love him. I would tell him how proud I am of the battle he fought, even if he lost the war. I would tell him I'm glad he's not in pain anymore, and that I'm so sorry we couldn't find a way to help him. I used to tell him, "You're an idiot, but you're my idiot." And as hard as it was to deal with his issues, I imagined how hard it must have been to be inside his head. He couldn't run from himself. We carry on with him in our hearts, and we try to remember the good times. He was more than an addict. He was always worried I would leave him, but in the end, it was him who left me. He left the world a better place. His last act was to donate his heart, lungs, spleen, and liver. This gift made those people's lives better. With all the shame attached to addiction, I'm glad in the end he did something to be proud of.
I'm Christy Reeve. I'm a registered nurse with Public Health, and I've been invited to today's event to go over recognizing and responding to an overdose. An overdose occurs when a person uses more of a drug or a combination of drugs than the body can handle. And as a result, the brain is not able to control basic life functions like breathing. Anyone can overdose. It can be a first-time user, it could be a long-time user, it could be somebody young, somebody old. And there's no exact formula for determining how much of a certain drug will lead to an overdose. As you've heard before, if you suspect someone has overdosed, call 911, give naloxone, and stay with the person until help arrives. So what is naloxone? Naloxone temporarily reverses the effects of an opioid-related overdose, so the individual can receive medical treatment. Naloxone kits prevent avoidable deaths and provide individuals with the opportunity to recover. Naloxone kits should be part of everyone's emergency first aid kit. There are two types of naloxone kits. There's a nasal kit and there's an injectable kit. Both these are available at a variety of pharmacies and other organizations throughout Hastings County. And a list can be found on our health unit's website by visiting HPE Each of the kit, whether nasal or injectable, contains 2 doses of naloxone, gloves, breathing barrier, and a 5-step guide. It is important to note that you not leave your naloxone kits in your hot car or cold car. They should be kept between 15 and 25 degrees Celsius. Before we get to using your kit, we want to let you know how to notice signs of an overdose should you come upon a situation. So somebody who is not responding to their name being shouted, they're not responding to you shaking them by the shoulders. The person basically is not waking up. You know there's something going on. If their breathing is slow or absent, a telltale sign is if their lips and nails are blue. The body could be limp. The person could be making some unusual gurgling noises, and their skin is cold and clammy. And again, at this point, you know that person is in medical distress, and it's so important that you call 911. Once you get your kit out, you're going to remove one of the packages from the kit. Oh, sorry, there. This is what the nasal one looks like. You're gonna peel back the tab to access the medication. There's a little leaflet in here. This is ready to go. There's no lid, there's no shaking. It's absolutely ready to go just like this. You're gonna place your fingers and your thumb on it. You're gonna put it up the person's nose and you're going to dispense it. Now, the next step would be to start rescue breathing and/or chest compressions. However, during COVID-19, rescue breathing is not recommended. If the person does not wake up after 2 to 3 minutes, you administer your second dose and continue with chest compressions until the ambulance arrives or the person wakes up. When the person does wake up, they may be confused. Tell the person what has happened and that help is on its way. If possible, stay with the person until the ambulance arrives. If at any point you need to leave, place the individual in the recovery position. So as well as having the naloxone kit and training, there are other things substance users can do to reduce their risk of overdosing. You've heard it before, a big one is to avoid mixing your drugs. Most overdose deaths occur when multiple drugs have been taken. Again, you've already heard about tolerance. This is the body's ability to increasingly withstand the effects of the substance being used, meaning longtime users require more than a new user needs. Use less drugs when your tolerance is low. Inconsistent drug quality and potency. Illegal drugs are unregulated, so there's no quality and strength are unpredictable. Always start with a small amount. You can always add more. And never, ever use alone. If you use alone, no one will be there to help you. Naloxone is not something you self-administer. It's something that someone has to administer to you. However, if you find you are alone and you need to use, call the National Overdose Response Service Overdose Prevention Hotline at 1-888-688-6677. This hotline operates 24 hours a day, and when you call this confidential and judgment-free service, the operator will stay on the phone with you while you use your drugs, and will call 911 and advise of possible overdose if they do not receive a response after drugs are administered. As we heard earlier, the statistic, the number of people affected by overdose is increasing around the world. We know locally our numbers have risen by 75% last year compared to 2019. We know naloxone is a life-saving intervention, but you can also help substance users in other ways. The way in which you speak to or about someone has a major impact on how they feel, how they are supported, and reinforces that they deserve treatment options for their health issue. The way we speak and the words we use matters. Using derogatory terms like junkie does not show the person you are very compassionate about their health situation. We can help reduce the stigma by choosing our words carefully. Treating the individual with care and compassion sends a message of hope. Those who are suffering need our support, not just when they're having a good day, but also on their worst days. The tragedy of overdose is far too frequent, but it's ultimately preventable. It is a time to come together, acknowledge our losses, and push to end the stigma of overdose. Thank you.
Let's start. My name doesn't matter. Just another statistic. Well, almost. My addiction started with prescription pills and grew to meth and fentanyl use on a daily basis. My life revolved around it. My next high. I stopped working and started boosting from stores to support my habit. I watched a family be torn apart and my relationship turn toxic. I've overdosed time and time again, to the point where waking up on the floor after someone narcaned me back from death became a normal event. I got a criminal record and went to jail a few times. I dealt with emotional and physical abuse or trauma. I've lost people. One of my best friends from high school had always been concerned about me and my drug use, unfortunately passed away himself just a month or two into my sobriety, when I was still so uncertain of my chances of success. It hit me really hard, but I know he would be proud of the progress I have made. I have had multiple strokes and been hospitalized from being awake for 13 days straight, paranoid out of my mind. Towards the end, death was imminent, and I expected it, how some days I welcomed it. It got to the point where I could either give up and just become another statistic like so many before me, or to get clean and get help and actually live a life worth living. I chose the latter. Addiction took everything from me. I learned there is no such thing as rock bottom. But to anyone who is where I once was, I want to say to you, there is hope. Things can change. You just have to want that change and the help to do it. I have been clean for 2 years. I had to remove myself from everyone and everything associated with my old life. I went on Suboxone and worked with the people at Addictions and Mental Health. There are many resources and programs available in the community. There is hope and the help for you to succeed. If there is hurt and a longing for more in your life, reach out and ask for that help. Thank you.
Wow, this is so powerful today. Thank you. Thank you for letting me be here. I hope Brian or Sherry or someone will let me know if I am talking too loud or talking too soft. Again, thank you. Thank you so much for letting me be here. I've been tasked, so I'm Dr. Melissa Holowaty. I've been tasked with talking about the treatment options available for opioid addiction and maybe dispelling some of the fake news out there about opioid treatment. So if there's one silver lining to the opioid crisis is that we have very effective medical treatments that can manage the symptoms of withdrawal, help with cravings, and reduce the risk of overdose. And that treatment is called opioid agonist therapy. Now, opioid agonist therapy is replacing that dangerous, unregulated, short-acting opioids that someone has to chase several times a day because they only last a short time, with a long-acting opioid such as methadone or buprenorphine. Now, buprenorphine is more commonly still known out there as Suboxone, so that's what I'm going to call it from now on, but the ingredient in it is buprenorphine. Or the even longer acting versions of Suboxone out there like Sublocade, which is a once-a-month injection that you get at your doctor's office, or Probufene, which are subdermal implants that go in your arm. Very similar to some of the subdermal implants you can get done at a piercing studio. And those actually release Suboxone in a steady stream for 6 months. Now, one of the lies out there about opioid agonist therapy is that it's just replacing one addiction with another. And that is just not true. Being on a long-acting opioid frees a person from that rapid cycling of being high and being dope sick several times a day. And it's regulated, meaning it's not cut with a Tizolam or some other designer benzo out there. And therefore, it's a relatively safe opioid that's always available from a pharmacy. And this means that a person can take all that time and energy that they spent on planning how to get drugs, finding them, using them, and recovering from them, and they can put that energy into things that may be more important to them, like their family, or school, or home, or work. Now, I think everyone is pretty aware of methadone as a treatment option. It's been used as a treatment for opioid addiction since the 60s. But because methadone can be a dangerous medication if used incorrectly, and if used incorrectly, it can lead to overdose. There are a lot of regulations with it, and many people can't make those rules about attending clinics and pharmacies work with their life. And some people do, but we now have the Suboxone options, which are much safer than methadone with respect to overdose. And there are a lot less rules with these products because they're so much safer. And like I said before, we now have the long-acting versions like the once-a-month injection or the 6-month implants that can really allow people to get treatment and still have a normal life that doesn't revolve around a clinic or a pharmacy. Another lie out there is that you can't switch to Suboxone from methadone, and you can't get onto Suboxone if you're using fentanyl. And you may know someone who has tried Suboxone from a friend or even from a prescriber, but it's because of the timing with their methadone that they may have gotten sick from trying it and not wanted to try it again. And I just want to reassure you that you can transition to Suboxone safely from fentanyl or methadone, but it has to be done using a microdosing protocol so that you don't get sick. And microdosing may sound really complicated, but it's actually really easily done. And it just involves taking small amounts of Suboxone tablets at first to ease into your system while you're still using other opioids. So you don't have to go cold turkey or anything like that. It's been around for 5 years now, and it was originally called the Bernese method that came out of Switzerland. It's easily done, and I've started lots of people using high doses of fentanyl or methadone onto Suboxone using this method. And once you're on the Suboxone tablets, you can move over to the once-a-month injection or to the implant, super easy if that's what you want. Now, some people also, got into opioids because of pain issues like their back, like back pain, and they're worried that Suboxone is not a pain medicine. And this is also not true. Suboxone is a very potent opioid, and it works as an analgesic, which is a pain medicine, just as much as methadone does. And in fact, buprenorphine is still used in veterinary surgeries in Canada right now. And given parenterally, 1 milligram of Suboxone equals about 70 milligrams of morphine. It's a very potent opioid. but it does have less side effects than methadone. It has less side effects than morphine. And so it can be an excellent option for people who also suffer from chronic pain. Another question I hear a lot about is people, they're worried if they go on Suboxone, they're not going to be able to take care of any extra pain that they may have. They're afraid that if they get hurt, they won't be able to take strong pain medicines because they're already on the Suboxone. This is another misconception or lie out there. You absolutely can treat pain if you're on Suboxone. I've had patients who've had their gallbladders out, had patients who cut off the tips of their fingertips actually on Suboxone, and we've been able to easily treat their pain. Your doctor or nurse practitioner just needs to know that you're on it to be able to treat that new acute pain appropriately. Finally, some people are worried about starting opioid agonist therapy because they think they're never going to get off of it once they start. And again, that's not true. But I do have to say it's also okay to be on it for as long as you need. We wouldn't tell a diabetic, okay, you've got 1 year to lose 60 pounds. And if you don't lose 60 pounds by the end of the year, we're stopping your insulin and good luck to you. Treatment for opioid addiction is no different than that. That being said, people are able to successfully come off of methadone or Suboxone or Sublocade or Pribuvine and live really regular full lives. And I had the bittersweet pleasure of saying goodbye in a good way, in that they tapered off of their opioids completely to 2 patients this past week who were really dear to me because we've just known each other a long time now. They came to me in really bad shape. They were looking for help, but we worked together. And now they both came to this amazing place that they never thought would be possible. No longer using drugs, no longer wanting them, and no longer even on opiate agonist therapy anymore. And it's just so wonderful to see. And it's hard to say goodbye when you've worked with someone so long and you've gotten so close to them. Oh, I did forget one thing. I do actually want to talk. I think there's the last thing about opioids is that there's this misconception out there that overdoses only happen to people using street drugs, or that opioid addiction only happens to other people. First, one of the worst non-lethal opioid overdoses in my practice was actually just an older lady who was on prescribed morphine for her arthritis. And she got the flu 1 year, and that made her kidneys not work as well. And so she overdosed because her kidneys just weren't able to handle her normal doses. And she was in the ICU for weeks. And secondly, I have a number of professionals in my practice. I'm blessed to have doctors and nurses and like a really wide variety in my practice. Addiction can happen to everyone. I have people in their teens. I have people in their 70s. Addiction can happen to anyone, and overdose can happen to anyone. I just want to point that out. We have a lot of places to get set up with opioid agonist therapy in our area, and I think that those are all listed, so I'm not actually going to mention them. I am going to change gears a little bit to take a minute to talk about alcohol. And so alcohol may not cause the sudden overdoses that opioids do, but it's actually still the drug that causes the most harms next to smoking in Canada. And Canada's safe drinking guidelines say that men should have no more than 15 drinks a week and women no more than 10 a week. And if you're drinking more than that, you're putting yourself at increased risk of harm, including increasing your risk of a number of cancers. And we know that people's drinking went up during COVID. So I think it's worth sharing with you that there are also medications that can help you cut back or stop drinking. And whenever I say that, most people think automatically of antabuse, which we used to use a long time ago, but we don't use much anymore. And it was the thing that made people quite sick if they drank while taking it. Like I said, we really don't use that anymore. Instead, the first line medications for alcohol are naltrexone and acamprosate, and they can be prescribed to you by your family doctor, your nurse practitioner, a walk-in clinic, as well as the RAM clinics in the province. And these medications just reduce your desire to drink or that craving to drink. You can still drink on them. You won't get sick if you do, but you just won't get the same high out of the drinks. And maybe instead of 8 a night, you cut back to 2 or nothing. And using those medications with addiction counseling and our mutual aid groups can really help reduce the harms from drinking. So we have good medical treatments available for opioids and alcohol, and I hope I've helped clear up some of the fake news out there. And I encourage you to look into these options, share them with people because they save lives and they help people move into recovery. Thanks.
Nobody said this was going to be easy. I was in an abusive relationship who cut me off from everybody, my family, my friends, and most of all, my son. I suffered many losses. I lost my apartment, my son, my family, hell, I even lost jobs. But worst of all, I lost 3 dear friends who unfortunately succumbed to their addiction. And all I kept thinking was how I wanted to change my life, to make sure I protect myself, because I don't know what is going to be in the next tainted drug I buy off the street. At my lowest, I felt useless. I was only good for cleaning and sex. Nothing but a whore. Not dependable. Neither my friends, family, or son, they were all better off without me. I even tried to kill myself. But for every negative, there is positive in the world. I was told by my current roommate, shape up or ship out. I never followed through with anything. Get help now or else. The very next day, I called Addiction and Mental Health Services of Hastings, Prince Edward County. From there, I was assigned a case manager. Through her, she introduced me to 3 special people. Delroy, my psychotherapist, Brian, my addiction counselor, and Stephanie, who is in charge of the opioid management program. We decided that Suboxone was the best route for me. I had weekly visits with Brian and Delroy, and I would see Stephanie as well. Then COVID-19 hit. Months went by, and we couldn't meet in person, so just phone calls from Brian, Delroy, and Stephanie would have to do. I needed to keep myself busy, so I enrolled into Belleville and Quinte Health Center, and through them, I completed Managing Powerful Emotions, Living with Chronic Conditions, and Living with Chronic Pain. I reconnected with my family, including my brother who had his very first child, a niece. I have few select friends that I trust, and I have all my support system at the Addiction and Mental Health Services in Prince Edward County. The Suboxone helped make a routine, and within a couple of months, I was up and going. Each day got easier, even with my anxiety and my depression. You may stumble, you may fall, but trust me, that's okay. Get up and try again. I started this program May 2018. I relapsed December 2018. But since then, it is now August 2021, and I've been sober since. Thank you, Addiction and Mental Health Services of Prince Edward County. You guys saved my life.
As the African proverb tells us, it takes a village to raise a child. I believe it takes a whole community effort to really help some people in need. I'd really like to thank our community partners for sharing this valuable information with us here today. We believe at Addiction and Mental Health Services of Hastings Prince Edward that this information can save many people's lives. We're not asking people to donate money or to give up a lot of your time. We are simply asking people that you really take to heart the messages and the information that has been shared here today. Thinking about how we talk to someone can make all the difference in whether that person goes and receives help, whether they feel value in themselves, and whether or not they feel supported. Learning how to spot an overdose, using naloxone, and calling 911 can save someone's life. And that is actually someone's life. That is not just a statistic. I am honored that people with lived experience have shared their stories with us today. They are truly inspirational and truly tell us that change is possible. At the end of our virtual symposium, there will be 3 phone numbers posted on a screen. One is the Crisis Intervention Center for anyone who is in crisis. The National Overdose Response Service number that Christy talked about earlier will be posted there. And for anyone who is in need of help or trying to help someone else with their addiction, whether it be counseling or trying to find a great addiction doctor like Dr. Holowaty, please call 613-310-OPEN. We are going to make a YouTube link of this video, so please look for it on our website. We are really hoping that you, if you know someone in need, someone who needs help, who could benefit from some of the information that was shared here today, that you please share this video with them. Thank you very much for joining us today. Be well and look out for each other. This is truly a time to remember and a time to act.
Listen to me, if you're out there and you're hurting and you want to find a way to get better, you want to find some way to make your life better, I think I can help you. I've been a drug addict for 20 years. I fought every fight there is to fight. And then I reached out. And the moment I reached out, I started getting better. When I was at my worst, I was absolutely devastated. My life was over. I had nowhere to go, know how to get there, and I had literally nothing left inside of me to do it with. I had nothing. I reached out. And the moment I reached out to AMHS, I realized that there's not only one option for me. I don't have to die in a ditch somewhere like so many of my friends and loved ones. I do not have to give up. I need to fight. I need to fight worse now than I've ever fought. This opioid epidemic is killing people all around us. It is absolutely crazy, and I can't even understand how this has gotten to this point. We need to fix this. You need to help your friends. You need to see someone in trouble and reach out to them and show them the way to reach out to others. To this day, or at this point, I am working full-time. I have a great relationship with my support network and those that are important around me. I'm reliable. I'm on time. People ask me for information. People trust me now. I've been rebuilding bridges that I never thought I could. And it's amazing. I want to tell you about my friend, Tim, who I lost along the way. And it breaks my heart because Tim is just good a man as I are better. We were kindred spirits. He was a good soul, and he was on the same journey I was. He was trying to get better. He was fighting. He was getting out of it. And he made one mistake one day that he actually had his bed ready, a recovery program or a treatment program, made one mistake, and he left his wife and kids, 2 kids, without a father. I didn't get to say goodbye. And all I could think was, that could have been me. That could be you. That could be any one of us that make the smallest tragic decision. And think about this. I have a full, beautiful life now, and I've only been clean for 2 years. 2 years ago, I was on the street. I asked for help, and there's help available. All you have to do is start reaching out, and there's going to be help there for you when you do. The people that helped me through this quite literally saved my life, and they can save yours. And I want to take this time to say thank you. I want to say thank you to my beautiful support networks, family, friends, whatever, it doesn't matter, my support networks. I want to say thank you to all the frontline clinics that are trying to deal with all this epidemic. And I want to say thank you to the support groups, all the different various support groups that you can sign up for free, and you know, have some friends that you can talk to that are going down the same path you're going down. You know, there's just something to be said about that, and a reminder of how bad things have been. Also want to say thank you to the wonderful staff at the court diversion program. They're absolutely non-judgmental and there to help, and I needed to feel like I was worth something, and the staff there actually helps you. And all of these support networks, all my friends, all the people that help me at AMHS, they help you feel like a real person. They help you realize your value. They help you realize that you can do this, and you can absolutely do this. You got to know, I've been at the worst end of everything, and I came back from this. I found my way out with the help of my support networks and the help of the professionals. I want to give a special shout out to Stephanie and Brian, who were hand in hand on my ass and in my business the whole entire time, and they expected nothing less than the best I could give. And I just want to say thank you to both of them for being key in saving my life. The Grace Inn and the staff there that were absolutely loving, courteous, and basically helped me through some of the hardest times of my life. Thank you guys.